Your hair is the crown you never take off, and if you're dealing with hair loss, it can be quite upsetting. And if the idea of hair transplants are in the back of your mind, especially when you see a lot of people on social media traveling to Turkey for a less expensive version of it, you may want to think twice. For many, the savings are tempting, but when it comes to a procedure that permanently changes how you look, cheaper doesn't always mean better. How do you know what's safe, what's risky, and whether traveling overseas for a hair transplant is really worth it? For advice, we're turning to an expert right in our own backyard in the U.S., Dr. Brett Bolton, a leading hair restoration specialist known for his natural results and expertise in modern hair restoration.
And my answer is it's a mixed bag. You definitely can get a good result there. I'm not saying there aren't qualified doctors in Turkey, but I always put the caveat, buyer beware. First off, the procedure that they're doing, in my opinion, is inferior to what we do with the strip technology. They're doing a technique that's called the follicular unit extraction, where when they harvest the donor, they're individually punching out the follicles one by one. We already learned from older styles, the hair plugs, that destroys the donor hair, affects the blood supply. They have to take it out of a larger area, which is not as safe for the patient as far as the viability of the graft that we're moving. It could potentially fall out later. So that's one of the biggest pitfalls. The second pitfall is I asked my patients that have been there, I said, did you find out who's working on you? Who's in the office that's doing your surgery? Are they qualified to do your surgery? Are they licensed? Who's in that room? What's your recourse if it goes wrong? And these are very important things. Are you able to look up the clinician, the doctor, the clinic? Do you have the ability to do the research that you can do here in the United States to get those fundamental answers to choose the best provider for what you're looking for?
And I would imagine that the follow-up care is really important too. So if you book a ticket to go to Turkey and then you need to come back home, who's going to do that follow-up care?
100%. What happens if on your way home you bump your head? Who's going to replace those grafts? What happens if you get one of these unusual infections? Who's going to follow your aftercare? So these are great questions you're asking, and that's the question the patient who's seeking that procedure needs to be asking for themselves.
So we're talking about the old way that they potentially do in Turkey. Let's talk about the newer technology and what you tend to do.
Okay, so what I always recommend is I recommend the strip procedure. This is where we open up the patient's donor hair in the back, where we physically are taking the strips out. We're able to look at them, we're able to see the quality of our grafts. We're able to get a much better quality graft. This is all proven by studies. I recently had a week where all 5 of my patients were corrective surgeries from Turkey with unnatural looking hairlines that were straight across to weird growth of the grafts. There were so many different, the itchiness of this. They had lots of side effects, which you can see here in the United States as well, but it was more predominant with patients from Turkey.
When is it a sign that a hair transplant is a good idea? Are there steps going up to this? Do you do consultations? How does this all work?
The way it works is step 1 is to get an evaluation by a doctor or provider that's focused on hair transplants. You want to go to someone that's all they do. And first step with everybody is to help keep what you have in place. We want to figure out why you're losing your hair. We want to make sure we stabilize that before we do a hair transplant on you, because we don't want to waste your time or your money. We don't want to give you a hair transplant, then you lose that hair, then you're in the same spot. So we do have FDA approved treatments that are out there. There's 2 of them. One is called Propecia is the brand name. The ingredient is finasteride. The other one is called the Rogaine. That's the brand name. The ingredient's minoxidil. Both FDA approved. Both work, but you have to do them. The reality is if they don't do it, they're going to continue to lose their hair, and it's just going to make it a tougher journey for them to get to the final result. We want to have it that stabilized so we can get them to the end game.
And I'm curious too, do you ever just sell the actual treatments without the hair transplant itself? Say somebody tries this and it works for them.
100%. Step 1 is always to get the prevention under their belt. With male pattern hair loss, we know why they're losing their hair. Their testosterone in their body is converting into DHT. It's causing this mucousy secretion called sebum to build up. That's miniaturizing the hair follicle. That's keeping it from making its way through. That Propecia finasteride is directly stopping that conversion. Minoxidil is a vasodilator, opening up blood vessels, allowing more minerals, oxygen, and nutrients to go where they need to go to allow a better environment for those miniaturized hairs to make their way through. So sometimes when we put the patients on these products, they might be able to revive some of those miniaturized follicles. So you're 100% right. If I have a patient that's early stage loss, I say, wait, let's get you on this a minimum of 6 months. Let's see if you're one of the lucky guys who gets that bounce back, and maybe we save you from having to go through this procedure. So you're 100% right. We always want to start off with the least invasive thing as possible.
So, Dr. Bolton, we've talked a bit about male hair loss, but of course, women suffer from this as well. Is that as easy to treat?
The answer is yes, it is. However, the female patients are losing their hair for much different reasons than the men are. Men at 99.9%, they're going to have that male pattern hair loss. Well, women can have male pattern hair loss as well. Thankfully, that's the easiest of all their choices for them to fix, and it's the easiest to diagnose. But what's happening with women is they're having so many other different things that can be happening causing the hair loss. When they go through menopause, they're having hormonal changes, whether they have issues with their pituitary or their thyroid, or they have a collagen vascular disorder. There's so many different things that could cause a female's hair loss. So we always want to diagnose what's causing their hair loss first. We want to get that stabilized.
If you get the hair transplant itself, what is the time like for recovery?
So the great news about hair transplants is that they're pretty minimally invasive. Procedure in my office usually takes around 3 to 4 hours, surgically speaking. The aftercare, we need you to be a good patient. Just like any procedure, you want to take care of it. That means no going to the gym, no heavy lifting. You want to minimize your motion. When you minimize your motion, that will help keep your blood pressure down. That will keep your pain down. That will keep your swelling down. Lots of patients are seeing nice results at 9 months, but we always say 18 months is the final result.
If you're going to invest in this and potentially change your whole aesthetic and feel better about yourself, go to somebody that knows what they're doing. And Dr. Bolton, let's talk about you and your history.
I recently was chosen by the world's greatest television show as the world's greatest hair transplant surgeon. And that aired nationally on Bloomberg. I've been doing this for 29 years. It's all I do. It's all I've ever done. I absolutely love what I do. I take pride on it, and I make sure all of my patients are happy. GreatHairTransplants.com, Dr. Brett Bolton.